I'm Dr. Dean van der Westhuizen. I'm an eye surgeon working in Mbombela. Today I'm going to quickly discuss what is a cataract and how it's treated. I think it's important to understand that a cataract is not something like a cancer or a growth in the eye. It's actually mostly a natural phenomenon that if you live long enough, you likely will develop it. Just to show you exactly where the issue is, essentially this is a model of an eye, and the part of the eye that we're concerned with is this part here. This is the lens, the intraocular lens of your eye. Now, you were born with a lens like this. When you're born with this lens is crystal clear, and it stays clear most of your life. At some point, this lens starts to deteriorate. Instead of being clear, it starts to become opaque. So you can see from this cross-sectional diagram, here is an image that the eye is looking at. This is the light coming into the eye, and that light is converged by this lens onto the retina at the back so that you're able to see that image clearly. This is the normal scenario, and this is the intraocular lens. Over here you can see the lens is nice and clear. You can see in this example that this lens is no longer clear. The lens has become opaque. As this lens becomes more opaque, light is unable to pass through it as it was before, and the image becomes more and more blurry over time. Typically, initial symptoms are difficulty with glare and halos at night, reading small fine print, and then blurred vision that gets worse and worse over time. Unfortunately, there's no medication that one can use to treat cataracts. There's no medication or eye drops, tablets that help. One needs to do surgery. In terms of timing of surgery, it really depends on the patient. Sometimes there's reasons to do cataract surgery more urgently, but really it depends on the function of the patient and what are their symptoms, and that will determine when we perform the surgery. So what does the surgery entail? The surgery takes about 15 to 20 minutes. It's done under local anesthetic, which is an eye block which numbs the face, but you're normally awake for the procedure with some sedation. And it's really not an unpleasant experience. Here you can see the front part of the eye. Just behind the pupil there is where the lens sits. So by dilating the pupil with eye drops, one can then access the lens. We open up the front surface of that lens and then start to break down that hard, opaque lens material and remove it with something called phacoemulsification, which is an ultrasound technology that helps to emulsify or liquefy the lens and remove it so that it can be done through very small incisions. Once we've removed the lens, the next step is to implant a lens to replace your old lens. Here's a typical example of an intraocular lens. It has an optic with two little legs that we call haptics that sit in the bag where we take your old lens from. Because obviously if we remove your old lens, the vision will be completely blurry, so we need to replace it with a new lens, and this is what the new lenses look like. These artificial intraocular lens implants are soft and malleable, which means they can be injected through an injector, and they unfold inside the eye, and they end up sitting in this bag where the old lens sits, and that replaces the old lens. There you can see the new lens implanted in the bag inside the eye, replacing the old lens with a new one. Because we are implanting a lens, we can choose the strength of that lens, and each eye that we do, we customize what lens implant we give to correct the glasses script as much as possible. And here is a photograph of a real-life example of the lens implanted. You can see the fine circle there where the lens capsule was opened, and here you can see the new intraocular lens implanted in the eye. So that's what a cataract is and how it's treated in a nutshell. I hope it was helpful.